Jonas, salk. Summer terror. In the spring of 1953, parents in the United States braced for another season of horror. Poliomyelitis, or polio, has sickened nearly 50,000 people the previous summer. That year, the disease had left 20,000 people, mostly children, with problems walking or unable to walk altogether. Another 3,000 people had died. In some cases, the polio virus caused cold-like symptoms, but in some cases, the virus paralyzed the arms and legs. In the worst cases, it paralyzed the chest muscles so people could not breathe. People avoided large crowds, and police quarantined homes and took sick children to hospitals, where they stayed for months, even years. There was one hope. Dr. Jonas Salk told the nation that the vaccine of polio was on the way. How to make a difference. Jonas Salk, born in New York City in 1914, was a good student who entered Townsend Harris Hall, a good high school for gifted students. When he was 12, Salk then went on to City College of New York by age 16. He wanted to do something to help humanity, and he wanted to become a medical researcher to fight diseases. Salk finished his studies just as the United States entered World War II. The military needed a vaccine to protect soldiers from influenza, flu, and other respiratory illnesses because the flu epidemic had killed more than 4,000 U.S. soldiers during World War I. Dr. Thomas Francis at the University of Michigan received money from research to develop a flu vaccine and hired Salk to work in his lab. When exposed to a vaccine, a body protects itself by producing special proteins called antibodies. These antibodies bind with the viruses and bacteria to help the body fight illnesses. The vaccine causes the body to produce antibodies, in some cases without giving it the disease. Salk developed a test to count the number of antibodies in the blood, which allowed researchers to tell how well a vaccine worked without having to wait for someone to get sick. To make the vaccine, the researchers had to kill the flu virus carefully. If the outside shape of the virus was damaged, the body would not recognize the virus and make antibodies. The team was successful in producing a killed virus flu vaccine that saved thousands of lives. Now 32 years old, Salk went to work as the head of the virus research laboratory at the University of Pittsburgh. Doing things his way, the National Foundation of Infantile Paralysis, NFIP, which raised money to help polio survivors, wanted to fund research on a polio vaccine. But Sil O'Connor, head of the foundation, was impressed with Salk's eagerness to get things done and gave Salk money for research. The first step to a polio vaccine was to discover how many types of polio virus existed. If there were dozens of types, as there with a common cold virus, a single vaccine would not protect people. Polio virus was hard to work with. Only humans get polio naturally, but monkeys can be infected within a laboratory. Traditionally, finding out how many strains of virus there were required months of work months or years of work. Researchers infected monkeys with one type of polio and waited months to see if the monkeys got sick or recovered before infecting them with new strains. Salk wanted to try something new. He wanted to give a monkey a light dose of an unknown strain of polio. The monkeys wouldn't get sick, but would produce antibodies against the type of polio. When given a known type of polio, its blood would flood with antibodies if the monkey was immune. If the virus grew, it meant the strain was another type. Most of the scientists at the NFIP conference that year, including Dr. Albert Sabin, a well-known and vocal polio researcher, scoffed at the new idea. The NFIP decided to fund the traditional typing method. Back in his lab, Salk worked overtime to try both methods. He found that the new method was faster and required far fewer monkeys. He then successfully tested for antibodies in tissue cultures, which are living material grown inside the body. Using these new methods, Salk's team determined that there were only 3 types of polio in 1 year, instead of the expected 3 years, dead or alive. In 1950, most scientists believed that only a live virus vaccine could give people long-lasting protection from polio. A live virus vaccine involves scientists developing a weak virus to put in the vaccine. When injected, the weak virus causes the body to produce antibodies, in some cases without causing the disease. Salk believed that a cold virus vaccine, like the one he and Francis had produced for a flu, would work just as well. Plus, it was safer. A killed virus could never give someone polio. The NFIP decided to fund both methods. With a team of 50 researchers, Salk went to work, but it was not an easy task to kill the polio virus without damaging it. They used the same chemical used to kill the flu virus. Experimenting with different temperatures and strengths to kill the polio virus, they had to make sure the method was perfect. Viruses are tiny. A million of them can line up in 1 inch. But one live polio virus in the vaccine could cause the deadly disease. As Salk's team worked, the beds of the hospital above the lab filled with sick children. The first tests. In 1952, Salk had a vaccine that worked on monkeys, but did he dare try it on children? Attempts of polio vaccines in the 1930s had devastating effects. Vaccinated children developed polio. Salk first tested a vaccine on children who had survived polio because these children could not get the disease again. It worked. The vaccinated children showed an increase of antibodies in their blood. Next, he vaccinated children who had not had polio. They developed antibodies and protected them from the disease, and they had no ill effects. He prepared to present his result at the next NFIP meeting. Word leaked out about Salk's work, and people started visiting the lab to get more information. The interruptions made it hard to concentrate, so O'Connor urged Salk to explain the project on the radio one time instead of giving many interviews. People were so excited that a vaccine was close that Salk became famous overnight. Sabin and other researchers were furious. Salk had mentioned other research in his interview, but they thought he was trying to take all the credit. He claimed that real scientists presented their research at formal scientific meetings, not on the radio. Salk ignored them and went back to work as polio sickened over 35,000 people in 1953. The trial. When Salk was sure he had a safe vaccine. He vaccinated himself, his family, and workers in the lab. O'Connor pushed for a huge field trial of the vaccine before the summer, which meant vaccinating hundreds of thousands of children. Salk agreed. If they delayed, thousands more children were likely to get polio. O'Connor went to work finding children to take a vaccine, organizing thousands of healthcare workers, and raising money. Salk's lab could not make enough vaccine in the time for the trial. He taught large dose manufacturers a precise method of killing the virus so they could produce the vaccine. The progress was so difficult that only 2 of the 5 manufacturers succeeded in time to make a vaccine for the start of the trial. Almost 2 million children were involved in the trial. Some received the vaccine, some a placebo, and the rest were tracked as a control group. Then came the months of waiting to see if the vaccine worked. Dr. Thomas Francis, Salk's old boss, collected and analyzed the results. Salk was about to become the national hero or a villain. On April 12, 1955, millions of people listened to the radio, and under part store speakers, Francis announced at the NFIP meeting, "The vaccines worked. It is safe, effective, and potent." Reporters ran to announce the news. Church bells rang, and people cheered in the streets. Salk rose quietly and gave a speech. He thanked past polio researchers, the volunteers, and those who had donated money. However, he forgot to mention the names of his team members. Forgetting to give credit to his team members angered many other scientists. Some never forgave him, but Salk was a hero to most people. He was interviewed on the radio for newspapers. People sent him money and gifts. He gave everything to the NFIP and returned to his lab to improve the vaccine. What went wrong? With summer coming, the NFIP began distributing free vaccine from all 5 manufacturers. The first signs of trouble came when from children given the vaccine got polio. The vaccine distribution was suspended. Salk didn't panic. He knew that the vaccine, if properly prepared, was safe. Investigators soon tracked the problem to one manufacturer that had not properly killed the virus. That vaccine was pulled, and the vaccinations continued. By 1962, the number of polio cases in the United States dropped to fewer than 1,000. Salk's vaccine worked, but it was expensive to produce. That year, the United States approved Sabin's live virus vaccine. It was cheaper than the killed virus vaccine, but plus it was given on a sugar cube instead of a series of shots. In 1979, most of the few remaining cases of polio were traced to the live virus vaccine. After 2000, the United States killed and decided to use only the killed virus vaccine. Salk had developed the first polio vaccine, and this vaccine finally eliminated the disease in the United States. New challenges. Salk went on to tackle new challenges. In 1960, he founded the Salk Institute as a place for scientists to work for the good of humanity. He researched diseases such as cancer and HIV/AIDS until his death in 1995. Today, the Salk Institute does cutting-edge medical research and has produced several Nobel Prize winners. Salk did not receive the Nobel Prize. At the time, many scientists agreed that Sabin when he said that Salk's work was pure chemistry. He didn't discover anything. Salk was the only major polio researcher ever elected to the National Academy of Sciences. Salk received thanks from his country and the world for saving thousands of children from the deadly disease. Time magazine named him one of the 100 most important people in the 20th century. He brought together discoveries from decades of polio research. He also used new ideas to develop the first polio vaccine. Salk achieved his goal of making a difference for humanity.